Hello there, this is Dr. Mintz. This is an interesting case of a 73-year-old who had severe abdominal pain and diarrhea. So what I'd like you to do at this point is to look this over and see if you can determine what looks abnormal. Okay, I'll give you that there is fluid in the peritoneal cavity. Notice the little nooks and crannies of the peritoneal cavity. This is fluid going back in front of the rectum and behind the sigmoid colon here. And here it is off in the right lateral peritoneal cavity. Let's see if any is going into the lesser sac. That would be in this area between the stomach and pancreas. Don't see any there. That tends to be the last place to finish or to fill. And here you have a stone in the gallbladder. Have a little cyst of the kidney. On the left there's one on the right too. You notice, very importantly, that this has a very smooth perimeter, a sharp demarcation from the adjacent enhancing renal cortex, which makes it a Bosniak category 1 lesion. That means that it is basically 100% certain of being benign if you can demonstrate those characteristics throughout the perimeter of that lesion. Likewise this. You'll learn about that in the renal course. So talking about the GI system, what do we see that's abnormal? This is a little more subtle, but I want you to see that if you follow the colon, and it can be a little hard to find the colon depending on the patient's anatomy and what the disease process is, but here you can see the hepatic flexure, and then we're going down, and here's the cecum. See how this looks a little funny right here? You have enhancing mucosa, it appears, a thin band of enhancing mucosa, but it has edema or low attenuation around it. It doesn't seem to be right up against the bowel wall. Similarly, if you look in this area, you see those little linear areas of enhancement, and then if we go upward, a little bit of enhancement here. This just looks kind of heterogeneous. It doesn't have the normal perimeter enhancement that you'd expect, like you see in small bowel right here and right here. It just looks kind of messy, disorganized. And let's see, we follow the colon over here. Here you can see some enhancement that's a little bit intense compared with normal for colon, but it doesn't seem to be pulled away from the lining. Here, let's go to the left colon. Here you can see how it looks all irregular. It doesn't have a contour that seems to follow very closely the bowel itself. Here you have this angular contour in this part of the mucosa, and here you can see this edema surrounding it. So this is an infectious process. It is Clostridium difficile is the infectious organism, and this is referred to as Pseudomembranous Colitis, and that's because the infectious process also produces pseudomembranes, and that's what we're seeing enhancing. And it tends to be produced by this Clostridium difficile organism, and it often follows patients who have been on an antibiotic for a fairly long time. So this is C. diff. That's Clostridium difficile. We abbreviate it in our conversations as C. diff, C period diff, and this is Pseudomembranous Colitis. If you see it and you think that might be what it is, you say, has the patient had antibiotics recently?